Good afternoon, everyone. Welcome to the Thursday, May 9th meeting of the Emergency Medical Care Advisory Board. I am the chairman for today's meeting, Mike Maggard, and I welcome you all to the meeting. So I'll call the meeting to order, and we're going to have a flag salute. Orchard, would you mind leading us? We're going to introduce our new members in a moment, but this is Orchard Cryer from the city of Taft. Would you mind leading us in the flag salute? It's right behind you. We have items on our, there are items, copies of the agenda at the back if you need to have one. Consent items are considered routine by staff. We usually vote on them all at once because they're rather routine in nature. And if you have a question about a consent item, we'll give you an opportunity to do that in a moment. They're indicated on our agenda with a CA preceding the item. Item number 5, the approval of our minutes is on consent. Item number 12 on page 2 of the agenda is on consent, and that's it. Do any members of the public have a question about a consent item? How about members of the board? Is there a motion then to approve the consent items? Thank you. We have a second. Thank you. All in favor, please say aye. 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 Thank you. Anybody opposed? Great. Thank you. Next, we're going to, we don't have any subcommittee reports today, but we offer an opportunity every time we meet for the public to express to us any concerns or ideas they have about items that are not otherwise on our agenda for the day. So are there any members of the public that would like to make a comment today about items not on our agenda? Yes, sir. I did not do that. We'll take a time out before we take public comment. Could you, Mr. Ferris, take roll?
Yes, sir.
Thank you, GK.
Okay. Mr. Surface. Here. Mrs. Wilmer. Here. Dr. Kansen. Mr. Peters.
Here.
Dr. Lyon.
Here.
Mr. Cryer. Here. I do not believe we have a quorum.
Six.
Okay. I just want to confirm that the chairman counts in this.
Yes.
Okay, then we do have a quorum. My
Okay.
apologies.
We're good?
Yes.
Okay, thank you. Then our vote that we took just a moment ago counts. That's a good thing. We have to vote again. Okay, public comment. Any members of the public have a comment they'd like to make to us? Since we are now official? Okay, we'll return to the board. No unfinished business. Under new business, item 10A on page 2 of your agenda is available MADI funds. Mr. Ferris?
Thank you, Mr. Chairman. If you recall the last meeting, for those of you who were here, at the last meeting, the Assistant Director of Public Health made a presentation regarding MADI funds and that we were changing the way we were going to be utilizing the 17% that we have available. And so now at each meeting I will be presenting you with the available funds in that account. And if you look at included in your packet was fiscal year 18-19 activity. And if you look at the second to the last column on the right side, other EMS 17% MADI balance, the current balance in that fund is $147,916.50. That concludes my report on that, and I request that it be received and filed.
Thank you, Mr. Ferris. Any members of the public have a question or comment? How about members of the board? Is there a motion then to receive and file? Thank you. Is there a second?
Second.
All in favor, please say aye.
Aye.
Aye. Anybody opposed? Thank you. Next is legislation affecting our MADI funds and program. Mr. Ferris?
Thank you, Mr. Chairman. Health and Safety Code 1797-98A authorizes counties to establish a MADI Emergency Medical Services Fund through the adoption of a resolution by the Board of Supervisors to reimburse physicians and surgeons and hospitals for the cost of uncompensated emergency care and other discretionary EMS purposes. The MADI EMS Fund is administered by each county. except when a county elects to have the state administer its medically indigent services program. Then the county may also elect to have its MADI EMS fund administered by the state. The MADI fund is generated by fines and fees charged for criminal offenses that occur within the geographical boundaries of Kern County. The MADI fund was scheduled to sunset January 1st, 2017. However, Senate Bill 867, signed by the governor on August 19th, 2016, extended the operative date of the MADI fund to January 2027. There is currently a piece of legislation that poses a direct threat to the MADI fund. Assembly Bill 927 would mandate that the court imposing a fine, fee, or assessment related to the criminal offense make a finding that the defendant has the ability to pay. Additionally, the bill would require that the defendant be presumed to not have the ability to pay if the defendant is homeless, lives in a shelter, or lives in a transitional living facility, receives need-based public assistance, is very low income, or is sentenced to state prison for an indeterminate term or a term of life without the possibility of parole. If passed, this law would have an effect on the amount of MADI fund monies that could be collected and distributed. It is because of this issue that the board released the MADI fund monies for enhancements that have positive effect on the system as a whole. It is the intent of EMS to monitor the legislative agenda, watching the progress of such bills. The Emergency Medical Services Administrators Association of California Legislative Committee, for which the Kern County EMS Program Manager is a member, is actively monitoring this and other bills that would have a negative effect on the EMS system. Legislative updates will be added to future agendas in an effort to keep this board appraised of the legislative climate in the state. That concludes my report, and I recommend that the board receive and file.
Thank you, Mr. Ferris. Any questions from the public? How about my colleagues on the board?
I have a question, Mr.
Yes, sir. Mr. Peters.
Jeff, it says because of this issue that the board released the MADI fund monies for this. So is there an action, because this is what you've already been doing. You've been using those funds, but is this an action item here that you're doing that's different?
No, it is not different. What the purpose for that sentence, or that statement in there was, my hopes are that the board review all requests for these funds so that they are used to aid the entire system, the system as a whole, so that when this sunsets or as the monies start to diminish, we have used them appropriately to help benefit the entire system.
Okay, yeah, I was just wondering if you were asking us to do something for you on this piece right now.
No, sir.
Okay, thanks.
No, sir.
Good question. Any other questions like that? Is there a motion to receive and file the report?
Motion.
Thank you.
Second.
Second. All in favor, please say aye. Aye. Anybody opposed? Thank you. Item 10C is a MADI funds request process update.
Thank you,
Ferris,
Mr.
sorry.
Chairman. As reported by the Assistant Director of Public Health at the February MCAB meeting, changes have occurred to allow for the release of MADI funds for the enhancement of the EMS system. The intended use of these funds is for enhancement for the system at large. The procedure for requesting MADI funds that was laid out at the last meeting is rather time-consuming. It creates months between the official request and the recommendation to the board. Additionally, it is the intent of EMS to release MADI funds only for such pieces of equipment or services that enhance, as I said earlier, the entire system, and not to pay for pieces of equipment or services that benefit a single provider or that may be mandatory for that provider. In response to these issues, EMS has developed a form that I included in your packet to be used for the submission of requests for the MADI funds. It is our intent to post this form on the Public Health EMS website, which will allow anyone to submit a request for the MADI funds. Additionally, it includes a field mandating the explanation of how the requested services or equipment enhance the entire system. Each request will be evaluated based on the information provided, and the outcome of the said evaluation will be presented here at MCAT. The completed form must be submitted no later than 30 days prior to the next MCAB meeting to allow us time to do that evaluation. I believe that if we put forth a form such as this or a request process such as this, that it will really streamline the process. Therefore, somebody doesn't have to come here, make a request, and wait 3 months to get the outcome. They can submit it, it will go directly to my office, we can process it, and at the next meeting, present our recommendations to you. That concludes my presentation, and I recommend that the board approve the process for requesting those MATI funds.
Thank you, Mr. Ferris. Any members of the public have a question or comment about this? I have a question regarding, are there any pending requests as of now?
There were 2 requests made at the last meeting. One was by Medical Director Dr. Lyon for a hand-heavy to be implemented in the system, and the other was by Bakersfield City Fire for aid in purchasing CPAP machines, yes.
So are those in the process of being evaluated still, or when will they be available? When will we know if they're available for us to take action on?
Those are still in the process of being evaluated. I wanted to set forth a process before making a determination or recommendation to this board.
Okay. Well, can we look forward to a recommendation up or down on those 2 requests when next we meet?
Yes.
And when is that?
That
It
is
says
in
at the bottom of our
August.
agenda, but August, okay.
Yes.
Very good, thank you. Any other questions? Mr. Go ahead.
My county council's recommendation is that perhaps the EMS director would consider defining the term benefit to the county EMS system at large. That way this board has a objective criteria to make a decision and or defend denial of funds.
So I'm sorry, GK, tell us one more time exactly what you're suggesting that's different than what we're proposed.
The request form indicates that a portion of Kern County MATI funds has been made available for the purchase of equipment and or services that are found to be of benefit to the county EMS system at large. My recommendation is that term be defined, that term benefit of the county at large means, and then have some objective definition so that this board can rest its hand on that definition and say we find that your request meets that criteria or it doesn't meet that criteria.
Okay.
In an
Yes.
in an attempt to expedite the process, do we have the ability?
Let me remind people, by the way, if you're going to speak, please push the button on the microphone because it's being recorded. Thank you.
So I guess my question is from county council, do we have the ability to vote on this and leave a provision that you would approve the language that you've asked for, so we don't have to come back in 3 months to delay the process anymore?
Absolutely. We can work with the director to implement my suggestion.
Thank you. And I would suggest that when you bring forward the 2 requests, if they meet muster to be, that you recommend them to us, that you include a justification about why they benefit the system, as suggested.
Okay, I will.
Then we don't have to pause for them any longer. Thank you, GK. Any other comments or questions?
With that clarification, I move we approve.
Thank you, Mr. Surface. Is there a second? All in favor, please say aye. Aye. Is anybody opposed? Very good, thank you. Next is item 10D. This is very interesting about what we're seeing happen across the country and what we're seeing happening here. So next is a report on the Cardiac Arrest Registry Program, and also known as CARES. Mr. Ferris?
Thank you, Mr. Chairman. Each year, approximately 350,000 persons in the United States experience an out-of-hospital cardiac arrest or sudden death. Approximately 90% of persons who experience this cardiac arrest die. Despite decades of research, median reported rates of survival to hospital discharge are poor, average of 10.4%, and have remained virtually unchanged for the past 30 years. Kern County is no different. In any given year, Kern County EMS personnel run anywhere from 1,000 to 1,500 cardiac arrests. Without a uniform and reliable method of data collection and a method for comparing that data with other areas of the state and country, Kern County cannot measure the effectiveness of our response systems, nor can we assess the impact of interventions designed to improve our out-of-hospital cardiac arrest survival. The data that we do have indicates that our out-of-hospital cardiac arrest survival rates are well below other areas of the state and country. Participation in the out-of-hospital cardiac arrest, or CARES registry, will enable us to compare patient populations, interventions, and outcomes with the goal of identifying opportunities to improve quality of care and ascertain whether resuscitation is provided according to evidence-based guidelines. The Cardiac Arrest Registry to Enhance Survival, or CARES, was developed to help communities determine standard outcome measures for out-of-hospital cardiac arrest, locally allowing for quality improvement efforts and benchmarking capability to improve care and increase survival. CARES is a secure web-based data management system in which participating communities enter local data and generate their own reports. The CARES system captures not only the data from the field, but also the data from the hospitals, allowing for the review of outcome of that patient. I believe that using CARES will allow us to compare our EMS system performance to de-identified aggregate statistics at the local, state, and national level, and discover promising practices that could improve emergency care. It is with this outcome in mind that I request that the board approve the addition of the CARES data into the mandatory data set for the Kern County EMS. That concludes my report.
Thank you. Dr. Lyon, do you have a comment about this as well?
Yes, I do.
Please give us your thoughts.
So cardiac arrest is kind of the ultimate measuring stick of a system. It is the sickest patient that we deal with, and one that we honestly have potentially the most impact on being able to send community members home to their family and hopefully neurologically intact, able to function normally. That is our goal. Right now, we have difficulty tracking that because we don't have consistent, accurate numbers to compare locally versus statewide versus national. The CARES database was developed by the CDC in conjunction with Emory University, and it's looking like it will probably be pushed out and required as a federally required database in the future. The goal is to have this as the nationally recognized by CMS and required in the future. So if we want to improve, we have to be able to measure what we're doing to be able to continue our improvement. So we're just starting to be able to get our numbers, and as of April 30th, looking at one of our agencies, the overall cardiac arrest survival was 6.1%. Wow. So we look at, one of the measures that we look at to compare communities is a specific type of cardiac arrest. Is one when somebody actually sees the person have a cardiac arrest and their heart is in a rhythm that can be fixed by defibrillation, being shocked. And our rate was 11.3%. In comparison, systems that are very high functioning cardiac arrest resuscitation systems like Kings County, Seattle, have upwards of 60, 65%. So we've started implementing some of the measures that they use in those kind of symptoms, but we need to be able to measure where we are and have our baseline to be able to know whether we're having an effect and improving our citizens' outcomes. So I do feel that this is an incredibly important piece of the puzzle to help improve our system.
Can you tell us, doctor, if there are these, what are the best practices in place in a place like Kings County that, where we could make our results better?
So some of the things we've already actually implemented. So we actually held what's called a resuscitation academy. They have a program called the Resuscitation Academy. in conjunction with Medic One, which is Seattle Fire Department's paramedic program, our colleagues from County Fire and I went up there and attended their program. We've since hosted one here, had some of their providers come down and help train our providers, and started rolling that out. And the biggest things that we try to affect is doing consistent, high-quality chest compressions, decreasing pauses from chest compressions, so doing as many compressions consistently at the appropriate rate and depth, which we measure during our arrests, and defibrillating the patients. And we do that on scene, so we do that wherever the patient has the cardiac arrest, because we cannot provide a high-level cardiac chest compressions during transport, and it puts our providers at risk if they're trying to do compressions in a moving ambulance. So the challenge is looking, is our compression quality adequate? Are we going too fast? Are we going too slow? So now we have to start looking at our kind of more detailed granular data to see where it is that we're lacking that we need to improve. Is it communicating to the public that they need to call 911 sooner and listen to the dispatchers and start doing CPR? We're starting to have more public education on CPR, and with the new high school requirement to teach CPR before graduation, that will start helping have a higher rate of CPR trained public. But we need more data to have a comparison to then measure and improve.
Very interesting.
Mr. Chairman?
Yes, sir.
Mike?
Mr.
We
Sherman.
also, Paul Emmons also attended the CPR event in Seattle and the one here in Kern County. We, along with the City of Bakersfield, started an initiative 2 years ago that we've refreshed again. Next month, every EMT and paramedic that works with us, as well as all the city firefighters, will be pulled together again for CPR training. And we've deployed some exceptional tools over the last several years. We can actually track on every CPR the rate of the compressions, the depth of the compressions, and how long the pause and the delays. And that's only part of it. The re-education and re-education and more re-education and more re-education. It's unbelievable what we saw when we first did some raw data analysis, that as professionals, we don't do very good CPR sometimes. People get in a hurry, they get tired, they're multitasking, and the quality of the CPR slips dramatically to the point of where it's just not effective at all. So we have scheduled again another session with City Fire. We're hopeful that we can get the same training set up for the county as well. And the City of California City Fire Department has expressed a desire to partner as well. So if all goes well, several thousand hours of CPR training will take place over the next couple of months. And then we're going to do it all again in July and August. So May and June will be CPR training, and then again July and August as we try to change the way people handle CPR on scene. And it really is, it's tough. If you've been doing CPR a certain way for 25 or 30 years, it's tough to change your mentality. But through good feedback, we've got good reporting on what's going on scene of the calls, and we certainly think that we can have an impact, and that the 1920 numbers should double, at least double is our first goal, and the next year double that again for return of spontaneous circulation. So there's a lot going on with it, and it takes commitment from everybody as a first responder to get involved, to make it work.
Colleagues, anybody else? Mr.
Question.
Peters, Mr. Peters.
Jeff, how much does this program cost, and who pays for it?
We pay for it. EMS pays for the CARES. We have a contract with CARES, and we pay the bill for that. It shouldn't cost you anything.
And then there's data abstraction that's required from the hospitals. How does that work?
I believe the CARES representative or the CARES system will send, if you receive a cardiac arrest, then you have to enter your back-end information on the outcome of the patient, and if that doesn't occur, they will send notifications to whoever you have as designated as your representative to remind you that you have an outstanding cardiac arrest data set that you need to enter.
Yeah, the part on the hospital side it's very small. Ultimately, it's basically, did the patient live and were they neurologically intact? There's not a whole lot more that they have to do. I think almost all the hospitals have already been trained and have already been entering data.
So the system's live already
Correct.
here?
Correct. So what this is doing is making this mandatory. So we don't have a complete system data set at this point. Soon we will. We have almost a full year's worth of data.
There's an old saying in accounting that you cannot manage what you do not measure. This is certainly an example of that. So, Mr. Ferris, what will the process be if we approve this today? What's the process between now and when it's fully implemented? What will the hospitals expect? What will the first providers expect? And will it? My second question is: does it go to the level of John Q. Public? If I bend over my mom and start doing CPR, will at some point I be exposed to a different way of doing that?
The system is basically, we have started to implement it in this county, as Dr. Lyons said. It's just a matter of reaching out to all of the entities in the county, making sure that they have a representative that has registered with the CARES system, and so that they can receive those emails, the hospitals can receive the emails and notification, and that every ambulance provider has a representative that can be contacted by CARES, and that they're entering each cardiac arrest as it's run. Dr. Lyon?
Correct. And to your point about how will this affect if your loved one has a cardiac arrest, this system does not directly affect in the sense that it's not going to tell you anything, but it's going to help us improve their chance of survival by changing how we respond to cardiac arrest. So, for instance, trying to improve our dispatcher recognition of cardiac arrest. It's incredibly difficult to recognize cardiac arrest sometimes when people call 911. The dispatchers do an amazing job. I don't know if you've ever sat in with them. It is very, very difficult to get information from people when they call 911, especially in a situation where somebody's had a cardiac arrest. And trying to recognize that and then convince this person that they need to get down and do CPR is incredibly important. And so working with them to improve that, trying to find our gaps of where we're going to need to aim. One of the other things that can directly affect you is downloading the PulsePoint app. This is live. This is an app that anybody can download. It's free. And if you're within a quarter of a mile of a cardiac arrest in a public location, this will send you an alert. If you have signed up and you know CPR, you can then respond and help try to save somebody's lives to try to decrease that time from their cardiac arrest to the time they have CPR started. So one of the things that we're exploring in the future is a verified responder program through the PulsePoint app, where if people are interested and they want to volunteer and they work for, say, a public agency, a fire agency, EMS, law enforcement, and they are verified, basically have had a background check and they're an upstanding individual, they can then get notifications in private locations, because the vast majority of cardiac arrests occur in the home. So this is something where if you have neighbors that you want to help and they have a cardiac arrest and you want to know before EMS and fire arrive to try to go over and help your neighbor, that would really play a big part.
Okay, good questions, exciting opportunity. Anybody else have a question, comment?
Move to approve.
Thank you. Motion to approve. Is there a second?
Second.
All in favor, please say aye. Aye. Is anybody opposed? GK, I did ask the public to comment on it, didn't I?
I'm going to say yes.
I think I did. Does anybody want to comment? Okay, I thought I did. Thank you, GK. Next, we have some new NCAB members and some staff changes we want to tell you about. So, Mr. Ferris, please handle item 10E, our MCAB membership, please.
Thank you, Mr. Chairman. Excuse me. We do have some new members. We have 2 new members that are sitting on the board. Very first meetings today. I'd like to welcome you both. Mr., and please forgive me, Orchel?
Yes.
Orchel Cryer from the city of Taft. He's been appointed as a member to the City Selection Committee. So I'd like to welcome you for your first meeting. And then Dr. Earl Canson.
Yes.
Welcome. He's a family practice physician, and he's been appointed as a member from the Kern County Medical Society Group. Welcome.
Thanks
Welcome.
for having me.
Additionally, not present today, we also have, I'm going to torture this, I know, Nadeem Goraya, MD, family practice physician, has been appointed as the alternate from the Medical Society. So that person will be your alternate if you can't be here. So I would like to welcome you all to MCAB, and I would like to reach out to you and schedule an appointment to sit down and have a discussion and give you kind of an orientation to EMS, what we do, and so you have a full understanding of your position here on the board.
Thank you.
That concludes my report. I recommend that the board receive and file.
Are there any staff members that are new to us you haven't yet introduced?
Yes, I'm going to talk about that in
In your report?
my report.
Okay, sorry about that. Okay, welcome you guys. Well, I'll give you an opportunity to sing the national anthem or something in a minute with board member comments. Any members of the public wish to make comment about our new members? One's an elected guy. Lots of people talk about it. Okay, return to the board then. Is there a motion to receive and file? Thank you. A second?
Second.
All in favor, please say aye. Thank you very much. Item number 10F, an annual provider performance report. Mr. Ferris?
Thank you, Mr. Chairman. On September 21st, 2006, the ambulance ordinance, or Chapter 8.12, was enacted. The ordinance established the exclusive operating areas that divide up the county for ambulance transport services. These EOAs were assigned through the execution of performance contracts with ambulance providers. The ambulance service performance standards, which were approved by the Board of Supervisors on December 5th, 2006, and revised by this board on November 23rd, 2018, outline the requirements that ambulance services must meet in order to remain in compliance with performance contracts. On a monthly basis, each ambulance provider is required to submit reports to the division for the monitoring of performance. The information is compiled and reported to the Board of Supervisors annually. In 2015, the board designated the May meeting as the annual meeting to review the EMS system. The division has finalized the following annual performance reports, and these reports are laid out based on contracts. So EOA 1 is Hall Ambulance Service. EOAs 2, 4, 8, and 9 are also Hall Ambulance, but those are in a separate contract. EOA 11 is Hall Ambulance Service. EOA 3, Delano Ambulance Service. EOA 6, Liberty Ambulance Service, and EOA 7, Liberty Ambulance Service. Each provider has been given an opportunity to review and report and provide feedback on these reports. That concludes my report, and I recommend the board receive and file the annual performance reports.
Thank you. This is an item the public might be interested in making comment about. Any members of the public wish to make comment today about the annual provider performance report? Okay, let's return to the board. Colleagues? Okay, recommended action is to receive and file. Is there a motion? Thank you. A second? All in favor, please say aye. Aye. Anybody opposed? Thank you. And finally, under new business item number G, an annual EMS system activity report. Mr. Ferris?
Thank you, Mr. Chairman. Title 22, Chapter 12, Article 4, effective January 1st, 2006, mandated the local EMS authority, or LEMSA, develop a system-wide implementation of a quality improvement program for the delivery of EMS care to the public. This includes mechanisms to track quality indicators for personnel, equipment, supplies, documentation, clinical care, patient outcomes, skill maintenance and competency, transportation and facilities, public education and prevention, and risk management. Health and Safety Code 1797.276 requires the division to report to the state annually regarding the activities of this board. Furthermore, it requires the report be submitted to the County Board of Supervisors. The EMS division needed to develop an annual report that compiled all of the quality improvement activities we are involved in and ensure they meet all the quality indicators required in Health and Safety Code and Title 22. This required the division to compile numerous data elements from over 100,000 EMS electronic patient care records. It also required cooperation with local hospitals to ensure an accurate and complete analysis of our system is presented. The division has developed a report that accurately summarizes the effectiveness of the Kern County EMS system and the activities of MCAT. The report meets all requirements set forth in Health and Safety Code and Title 22 and follows the guidelines established by the Emergency Medical Services Authority, or EMSA. The division is proud to include this report in your board member packets, and a copy will be submitted to EMSA and the Kern County Board of Supervisors. That completes my report. I recommend that the board receive and file the annual EMS systems report for 2018.
Thank you. Any members of the public wish to make comment about this? Okay, colleagues, how about you?
I think we should give some kudos to Margaret Mize for putting this together. She's our epidemiologist. She did an amazing job putting this together.
Very good. Can you extend our gratitude?
I would agree that it's
I will certainly do that.
Thank you.
the best annual report that we've seen. It's really thorough and
Very good.
it's good.
That's encouraging. Colleagues, any other comments or questions? Okay, is there a motion then to receive and file? Thank you. Is there a second? All in favor, please say aye.
Aye.
Aye. Is anybody opposed? Thank you. Now on to the manager's report. I have jumped on your toes before about presupposing what you were going to say. I apologize for that. Mr. Ferris?
No worries, sir. Thank you, Mr. Chairman. I think that we've thoroughly covered 2018 in the systems report and in the annual performance report. So my report today is going to be on focusing on 2019, what we've started, the beginning, and where we're headed this year. So we remain committed to providing life-saving education and training for our workplace and our community. Early this year, EMS staff trained approximately 300 Wasco Unified School District employees in Stop the Bleed, and we are scheduled to teach the Delano School District employees in June. That could total another 200 employees trained. We completed the Stop the Bleed training for public health staff, and we ended up placing 4 Stop the Bleed cabinets and AEDs in this building to provide coverage for all of our employees. We're now planning to train all of environmental health next. In April, EMS hired a new EMS coordinator. I would like to introduce you to Chris Parks. Stand up, Chris. Thank
Welcome,
you.
Chris.
Chris comes to us with 15 years of EMS experience. He started his EMS career in 2004, working as an EMT for AMR Ambulance in San Diego. In addition to working as an EMT, Chris has worked as an emergency room technician, a firefighter, and a paramedic. Over the last 4 years, Chris has been working as a paramedic here in Kern County. Chris will be taking over the STEMI and burn systems of care, sidewalk CPR, and he's going to assist with enforcement. So let's talk about it. It's happening right now, lightning in a bottle. If you don't know what it is, you've been asleep and haven't watched the news. The event began yesterday out at the Buena Vista Aquatic Recreational Area. It's a large music festival that attracts people from all over the United States as well as multiple other countries around the world. EMS staff members George Baker and Nick Lidgett were originally assigned to prepare EMS and public health for this event. Together, they developed a comprehensive operations plan for this huge event that has been shared with Kern County Fire, Sheriff, Behavioral Health, and Hall Ambulance Service. EMS staff are present right now at the event and will be there 24 hours a day throughout this event to provide centralized dispatch for the ambulances, ensure that the event promoter's medical plan is executed appropriately, to manage any large-scale incident that may occur, and to assure the timely requisition of additional resources should they be needed. This is an extremely important event for Kern County, and it is our goal to make sure that this is successful and has as little impact on our system as possible. As of 6 a.m. today, we have completed our first 2 12-hour operational periods with 1 patient transported to a local hospital. The numbers of arrivals reported for the first day were 1,000, and they're expected to receive between 7,000 and 8,000 arrivals today. EMS coordinator and RDMHS Nick Lidgett will be speaking at the California Fire EMS Disaster Conference, or CFED, at the end of the month. Nick will be speaking with EMS partners, with EMSA partners, state officials, to instruct on the proper procedure for ordering medical health resources during a large-scale disaster. Nick will be using the Kern County Behavioral Health Critical Incident Stress Management Team's response to the Camp Fire as an example. This response marked the first time that behavioral health was requested and responded to a large-scale incident. The team responded to provide mental health first aid to Paradise Police Department personnel who were greatly affected by that disaster. Additionally, as a result of that response, EMS is working closely with behavioral health to develop a response plan for Kern County so that we can dispatch and have behavioral health respond to provide mental health first aid to our own first responders in the event of a large-scale incident. In March of this year, EMS personnel developed and facilitated a point of dispensing, or POD, drill that simulated a pandemic outbreak. Participants included public health nurses, CSUB students, behavioral health, and Kern County Public Health Administration. The POD was an overwhelming success, and plans for another POD are already in the works for next year. We also assisted both Kern Valley State Prison and California City Prison with exercises this year, and both have requested our involvement in additional exercises next year. We also participated with Kern County Fire on an exercise right across the street at East High. This drill was designed to test the ability for first responders to search out, rescue, package, and transport patients following a large-scale earthquake. So far in 2019, EMS staff have reviewed over 4,500 patient care reports, conducted a field audit of one of our EMT first responders, and worked closely with Hall Ambulance Service to integrate First Watch as a valid compliance data reporting tool. And we have identified the zip codes within the county with the highest incidence of stroke, and are working with hospitals and public health to target those areas for community outreach. And finally, EMS continually strives to work with our stakeholders, community members, and public health staff to find ways to expand our ability to respond and to be prepared for disasters. EMS remains focused on identifying trends and opportunities to improve the health and safety of the community and provide assistance to our stakeholders. This concludes my report. It is recommended the board receive and file, and I'm available to answer any questions.
Very thorough, thank you. Any members of the public have a question or comment about that? How about my colleagues on the board?
Mr. Chair?
Yes, sir.
One of the things missing that I think is important, Jeff, was the assistance, or the idea that you're now getting involved in trying to regulate the abuse of 911 by some of our citizens. We had the one fella that called 50 times in 30 days, and the department sent some resources out. Eventually, law enforcement got involved, and he stopped calling for a little while. He's now calling again, but he did stop. But every time that these folks that have used the 911 system, every time they call and they go to a hospital, they don't get what they're looking for, which is not going to happen in the hospitals because they're looking for something that they don't need. They walk outside, they can go to payphone, they call 911 again. So I think that it would be important for the department to start tracking your efforts for 911 abuse. And hopefully next year in your annual report, you can include your effort to help in that regard.
Well, thank you, John. We actually are working on a policy to identify those abusers and create a way for the providers to deal with those so that we don't transport people 60 and 70 times within a month or two.
Boy, what's at the core of that? How miserable is that existence, that person is doing that all day long, every day?
It's a mental health issue.
Yeah.
The bottom line is a mental health issue,
Right.
and mental health has responded. We had one fella that they came out and met with him at the hospital, and they connected him to family in another city, and that's where he ended up. But in the end, it really is a mental health crisis that's manifesting as 911 calls, and those people go to the ER. They don't get the mental health help they need, but they're coming in asking for medication, or they're asking for something to kill the pain, different things. And the hospitals, I know we talked about it at the last meeting, the hospitals have done a really good job of not being a dispensary anymore for people that are coming in looking for pain meds. And that our local hospitals were way ahead of everybody else in the nation. I think it's been 3 years now since the hospitals got together and said enough's enough. But we do have a significant mental health crisis, and it does manifest as unnecessary 911 calls.
Yeah, our policy we're working on includes cooperation with public health nursing, mental health, and law enforcement as well. So they will all be combined in this policy to help these people get the assistance they need.
Okay, any other comments? Is there a motion to receive and file?
Motion.
Thank you. Orchell's on the record. Is there a second? Thank you. I think Mr. Service did. Thank you. All in favor, please say aye. Aye. Anybody opposed? Very good. Board member announcements or reports. Gentlemen, I would never ask you to sing, but would you like to tell us anything about yourselves? And then we'll go on to Mr. Peters about why you endeavored to join us and anything like that?
Just don't miss any meetings. No, I'm in my main occupation is farming, agribusiness, and I've been doing it for quite a few years. I'm on the Taft City Council, Mayor Pro Tem. I enjoy being on different boards to make our community a better place. And pleasure to be on the board here. Thank you.
Very good. Dr. Canson, anything you want to tell us?
Yeah, sure. I'm a family physician. I work full-time in urgent care for Kaiser Permanente. I was informed of the opening position by Dr. Chang Na, and recommended that I consider it. And I've been looking for an opportunity to participate in the county and be of assistance in some way, and so I was happy to step up.
Great. Glad to have you here. Mr. Peters, did you have something today?
Yes, Mr. Chairman, just as an FYI point of interest, I think, after the two false active shooter events that happened at Mercy Southwest and Bakersfield Memorial, you may recall that the perpetrator acknowledged causing both of those, actually was sent to jail because of impersonating an officer. He was not able to be charged at Mercy Southwest for calling any false active shooter event. I worked with Assemblyman Fong to try to add language to a bill or a law that already exists for bomb threats and other things where a false active shooter activation that, has the effects that it did on both of our hospitals, that they could be charged with a crime of some sort. And we worked with the DA's office. They asked that it be called a wobbler, meaning they could charge as a misdemeanor or a felony depending upon the nature of the incident. Ultimately, that bill was introduced. I went to Sacramento to testify at the Public Safety Committee of the Assembly, along with Cynthia Zimmer, and that bill was defeated.
Was it a wobbler, or did it have a chance?
At all. It was not added at all. They were concerned that, they said it was vague, it was, we had a whole parade of people that testified in favor of it, and ultimately the ACLU and one other agency testified against it as being unnecessary. So that failed. We may give it another go at some point. It probably didn't help us that a bill introduced just prior to that to the committee was to expand the concealed carry law. So I don't think they were in a very good mood when
Timing is everything.
yeah. So I just wanted to mention that we did attempt to do that, and that it did fail.
We once, at the city of Bakersfield, when I was a councilman there, successfully prosecuted someone as a felony for graffiti because the cost of the response to mitigate the graffiti, he tagged a bridge that went across Truxton Extension, and it required the stopping of trains, which was very expensive. And that young man became an example to many other people because of the consequent cost of what he had done. I wonder if there's a way we could endeavor to help you with the extraordinary cost that resulted from this man's call.
That was actually part of
ramp it
the
up.
bill that required restitution on the part of the person that did it, and that was one of the things that they were opposed to.
Go figure.
Yeah, go figure. I thought this was going to be a slam dunk, and I was just shocked when I walked out of there.
Anybody else? Ms. Wilmer, do you have anything you'd like to say today, or Mr. Surface, Dr. Lyon? No, we're good? I have one question I'd like us to address at a subsequent meeting. It has to do with what effect do you see, are we recognizing the increase in homelessness having on our ability to respond to emergencies, to our first responders, to, how's the system clogging up? Are there any recommendations of what we can do about it? I just would be interested for us to take a look at that issue.
Thank you, Mr. Chairman. I will report on that.
Thank you very much. Any other comments? Okay, thank you. Our next regularly scheduled meeting is Thursday, August 8, 2019, 4 o'clock in this room. And if you would like to present something to be heard or recognized at that meeting, you can submit public requests by Thursday, July 25th, 2019 at 5 p.m. to the Kern County EMS Program Manager. Anything else before us? Mr. Kalsa? We're good, thank you. Okay, I'll call then for a motion for us to adjourn.
Motion.
Thanks, thank you very much. At 4:53, without opposition, so ordered. Thank you. We'll see you guys next time.